A new study published by the British Medical Journal has found the number of people diagnosed with early-onset cancer has risen significantly in the past 3 decades. It shows a 79% increase in cancer patients younger than 50 in the last 30 years. Cancer of the breast, windpipe, bowel and stomach are amongst the most prevalent. The research found more than 1 million people aged 50 or younger die of the disease every year, with that number projected to rise by 21% in 2030. Now, scientists studied data from more than 200 countries involving 29 different types of cancer. Let's speak now to Nicola Smith. She's the Senior Health Information Manager with Cancer Research UK, and she joins us now from London. Great to have you with us. How alarmed should we be at these figures? Are people actually getting cancer younger, or are we just getting better at spotting it?
So that's a very good question. It's quite a complicated picture, and the evidence does suggest that there is a small but significant increase in the rates of cancer at an earlier stage, below 50. However, the numbers on this paper do seem more alarming because they've looked at the number of cases in those headline figures rather than the rates at which people are getting cancer. And the number of cases doesn't take into account population growth. So as populations are growing over the decades, we are seeing more people as a whole, so more people are being diagnosed with cancer. And that's certainly an important factor at play here. As you mentioned, we're getting better at detecting it. Over the last 30 years globally, we are getting much better at detecting cancer, and also the recording of cancer globally is significantly better than it was 30 years ago. So that certainly is playing a role. However, we do think that there are likely other factors at play, so genetics and also risk factors. So earlier exposure to risk factors is a particular worry for some of these cancer types, where we are seeing cancers that could be prevented, that people are experiencing at an earlier age than they may have otherwise. And
when you talk about risk factors, you're talking about smoking, exposure to sun, eating certain types of foods. We've known about these risk factors for a very long time. Why do you think people still indulge in these behaviours to such a level that it does keep giving us cancer?
So we are seeing things like smoking, overweight and obesity, alcohol consumption, diet, as you mentioned, what people are eating. The study found that in the West, linked to Western diets probably is a factor at play there. We are seeing more cases of cancer. So there is something important there for people to take away, to think about how they might be able to make healthier changes. Unfortunately, it isn't necessarily that easy. The world around us does have a big impact on the choices that we feel are available to us, and the advertising that we're exposed to, the laws in our country, the food that we're exposed to in our day-to-day life. It does all play a part in the options that are available to us as individuals, and there is an important thing around awareness and people being able to make those choices once they have the information available, but the world around us doesn't necessarily make it easy.
No, it doesn't. And what's the prognosis for these people who are, the younger people who are finding this early onset cancer?
So the study looked at cancers between the age of 14 and 49, and between those age ranges, it could look very different in terms of someone's cancer experience. Most of the people in the study who had cancer were in their 40s, and we know that the occurrence of cancer increases as we get older because the cells, the changes that can develop in our cells, the mutations in our DNA, they can build up over time, and that's why normally most cancers are experienced at older ages. But the most important thing when we're looking at cancer prognosis is trying to catch it at an early stage. So if you are experiencing any symptoms, anything that's unusual for you, something that just doesn't feel right, then we're going to see your GP, going to see your doctor, and telling them everything that's been going on, being persistent if those changes don't go away. If something's not normal for you, you know your body best, so make sure you're getting it checked out. And then if it is, it's not likely to be cancer, but if it is, picking it up at an early stage, you're more likely to be treated successfully.
Nicola Smith, that's great advice. Thank you.